My name is Nico Wulffraat. I'm a professor in pediatric rheumatology in Utrecht, the Netherlands. That's an academic hospital, referral hospital for children with immunological disorders, such as immune disorders, deficiencies, but also rheumatic conditions, especially juvenile idiopathic arthritis. The focus of my talk is immunizations in rheumatic diseases. This is an issue because of safety and efficacy concerns. It appears that some drugs may hamper the immune response, where also it is unclear whether vaccinations could cause relapses or even new onset of the diseases, rheumatic diseases. And therefore we have conducted a series of studies addressing these immunizations, especially focusing at medications and dead vaccines, and also live vaccines such as herpes zoster and mumps, measles, rubella vaccine in children. Vaccinations are used much more often in children. There it is a bigger concern as compared to the adults. I think in adults the main issue is, for instance, herpes zoster vaccinations, where you see that it is clearly recommended. It is used in practice very little in older patients with rheumatic conditions, where it is clearly proven that such a vaccination can reduce the incidence of neuropathic pain, the herpes zoster pain, which is a very tough condition after vaccination.